Welcome to CRH Talk, where we feature rural health professionals and dive deep into prevention, treatment, and building lasting health.
Welcome everyone to CRH Talk. I have Danielle Mong here. She is our new trauma coordinator. Is that correct? Is that the complete title, or do you have anything else to that new title?
Clinical Supervisor as well.
So she's our new clinical supervisor in the emergency department and trauma coordinator. So I wanted just to introduce you to her because she's been here now for 4 or 5 years.
5 years.
For 5 years, and a nurse for over 20 years, and has a lot of experience that she's bringing. And so Danielle, maybe just tell us a little bit about yourself and...
Well, just to add to that, I have been in the emergency department in various states, in Colorado and Missouri, and then here in Cody for the last 17 years. So it's kind of been my passion now I didn't, ever leave it, so that's good.
I don't know how you all do it in ER and in clinical world. I'm thankful I'm in marketing. So
I'm thankful you're in marketing too.
I'm glad we have people like you who are willing to save our lives. I wouldn't be much help. But yeah, tell us just a little bit too about what you enjoy outside of work, because I know you are a busy lady.
Well, I have 3 kids, so that keeps you busy, and I'm married, and just involved with our community of friends and our church and sports.
You're always going, it seems like, on top of what you already do here. So yeah, why don't you just tell us about this new role that just came into fruition and what it's all about so people can know.
Well, first of all, you have to have the basis of what happens in trauma. So basically, when there is an accident or an incident where somebody has an injury, they're evaluated by EMS, and based on criteria, EMS decides if they are a priority 1 or a priority 2 trauma, and they contact the hospital and let us know.
As they're coming to the hospital, like,
before
hey,
they even leave the scene.
Ashley just fell off a horse,
Yeah.
cracked her head open. I would be considered a trauma 1 or 2?
2.
Oh boy, okay. Okay.
So, in the background, the emergency department is preparing a multidisciplinary team to take care of this patient. So that's what EMS is preparing us to do. So, depending on how much time we have, so say they're going to be there in 10 minutes, they call it overhead. So, cardiopulmonary, pharmacy, lab, radiology, surgery, ER, everyone who is in those departments stops what they're doing to come and care for this patient who is critical and needs all the attention right now. Every minute counts. So, you could be in the middle of x-raying somebody and you say, well, you have to leave. And you go and take care of this trauma patient. And then when the trauma patient arrives, there's a methodical route that we take every single time so that nothing is missed. And then, so we go through that process every time. So what my job is to make sure that all of those things are being done. So I look and critique the whole chart and the response times, and then we sit down at a trauma meeting, again, with all of those people, department heads from those people, from those various departments, and discuss how we can improve, what the standard of care is, and, what we did good, what we didn't do good, and to always be in a constant process improvement of and quality improvement of our patient care that we give.
So you're going to be the one who's like, hey, we rocked it, or didn't do so well.
Right. And I do that
Okay.
along with our trauma medical director, which is Dr. Etter.
Dr. Etter. Okay.
Mm-hmm.
Okay.
So, and then with these meetings, there's a whole gamut of things that we have to do to prepare for these meetings, chart reviews and PI, performance improvement reviews and that sort of thing, to get everything ready. Also, part of my job is trauma registry, which is with the state. There's a website, and you go in and put in all the data, and then just like we had our trauma survey here recently, they collect all that data, look at it when they come to do our survey. So they're seeing everything that we're doing and then making sure that we're up to par and standard of care for all of our trauma patients. And with our last review, we passed everything and did really well.
Yeah.
So we're doing what we're supposed to be doing. So as we go forward, because each part of this whole process was kind of done by somebody else who had a full-time job already. They decided, as we've grown over the last years, that this now needs to be a dedicated role, and it would better service everyone if there's one person that's a point person and doing all of those things. So I do the trauma registry as well. So also going forward, we will be being able to kind of expand out a little bit. So if a patient gets admitted upstairs, we didn't have the resources to do this before, to be able to go up and round on them and make sure that everything is going well and that they have everything they need to be discharged home. Also, if a patient is transferred to a higher level of care facility, such as Billings, they all do the same thing. They're doing chart reviews. Their whole trauma program is also invested in us as a level 1 trauma center, meaning that they have all of the things that anybody would ever need, from neurosurgery to every aspect of care that a patient would need. They are invested in us to educate us and teach us, so we learn from them, and they give us feedback on all of our patients that we send to them. So we present that also in our trauma committee meetings that we have.
And that's Billings?
Mm-hmm.
Billings?
Both. It depends on, if we either hospital, because they're both
That's
trauma
great.
centers.
So now everyone's kind of making sure that we're all transferring correctly, making sure we're prepped and ready and do the right process.
Yep.
That's huge.
It is.
Wow.
And so along with other things that I would like to expand on, injury prevention, trauma deaths are the number 1 killer of people in Wyoming from ages 1 to 44.
Wow.
Number 1 cause of death. So that's huge. And that's why it's
Yeah.
important to our community and our hospital. We need to be spot on with these things because every minute matters. So,
what does a trauma death consist of? Is that like a horseback ride
could be.
gone wrong, a bike without a helmet?
Yep. Motorcycle.
Trauma, okay.
Injury.
Okay.
That causes death.
Yep, okay.
So injury prevention, any of those things could be, motorcycle helmet awareness.
So we're going to see you at all the parades passing out helmets and...
Oh, yes. Well, we will be coming up with some things for injury prevention for sure.
Awesome.
And so with the registry as well, I wanted to mention that was, we enter all that data into the state registry. They use that information to create policy and law. And then those can also go nationally to create policy and law. So seatbelt laws, helmet laws, children safety seats laws have all stemmed from trauma registry and them collecting the data on that. So we're reducing deaths from all of this process.
It's great.
Yeah.
So your job is really important, and that's why we wanted to have you on, is because we want people to understand what exactly is the trauma coordinator. And then the other half of your job title, tell me again.
Clinical Supervisor.
Clinical Supervisor. Does that kind of just fall in, or does that entail anything else?
Well, education, making sure that they're like working with our nursing educator to make sure that the staff has all the education that they need, the supplies that they need, and anything else that our director needs help with, which could be anything depending on what season we're in. So.
Yeah. And we had Megan Moss, our current director of our ED, on, and she did talk about the survey, how you guys rocked it and did a really great job. But yeah, you all do an amazing job down in our emergency department, and I would definitely feel like I was in good hands if I ever had to come to you. My husband, I can share that, recently went over there, and they did a phenomenal job, so Good. He was very thankful. But is there anything else you want to share with everyone about your new role and what they can expect?
I don't think so.
Okay. If for some reason someone has to get in touch with you, maybe you have a great program that you want to talk to Danielle about, how would they get in touch?
So it's dmong@codyregionalhealth.org.
Okay. We'll put that email down below in the show notes. But Danielle, thank you so much for coming on. I know it's not the funnest thing to be in front of a camera or have people listen to, but this new role is very important to Cody Regional Health, and we just wanted to share what you have going on. So thank you again for being here. And thank you everyone for listening or watching. Please subscribe, share this with whoever you think might benefit, and leave a few comments. If there's anything you want to hear about what's going on internally at Cody Regional Health, please let us know. And just a reminder, we are right in the middle of our new electronic health record transformation. So if you have any troubles, just let us know. Reach out to us at codyregionalhealth.org or call us at 527-7501. We are here to help and take care of you, so thank you for listening.
Thank you for listening to CRH Talk. Please subscribe, rate, or share this podcast. Check us out at codyregionalhealth.org and see what services we offer locally in Northwest Wyoming.